Fine. You can start, please.
Hello, my name is Dr. Shiza, and I am one of the doctors in the cardiology clinic today.
Yes, doctor.
Are you Mrs. Kamala Perker?
Yes, doctor. Mrs. Kamala Park is speaking.
Okay, so Mrs. Kamala, nice to meet you.
Nice to meet you, doctor.
So we are here today to discuss about your husband, Mr. Peter, 55 years old, his health condition. Is that correct?
Yes, doctor. I'm waiting for that. Thank you for coming.
I hope I didn't keep you waiting for too long. So,
No,
Mrs.
it's
Kamala,
fine.
mm, I would like to ask you first, what do you know already about his condition?
Well, doctor, my husband actually going through some chest pain for the long time. He's been for last 2 months, and we did few tests, X-ray, and also some heart racing. And based on that, your doctor did another test. His name probably angiography, something like that. And we are waiting for the test result, doctor.
Okay, well, thank you so much for sharing this information with me. And may I know what are your expectations from the test, or has anybody discussed anything with you before this?
No, I mean, no one discussed me. I mean, I'm waiting for the test result because in the previous investigation, they found something, and that's why I'm very anxious. Okay, it is something serious. So I'm hoping nothing would be serious, just medication could be the next step or probably next plan from your side, doctor. That's why we are waiting.
Okay, I can see you must be very worried about your husband. Well, Mrs. Parker, I have the test results with me, and I am very sorry to tell you that the results are not as good as we hoped.
So
Um,
what do you mean by is not hoping something?
uh,
What do you
ac-
mean by
ac-
that?
as you told me that he angiogram was done. Angiography is basically the imaging of the heart to heart vessels to see if there is narrowing, how much narrowing is there, and what
Mm.
could be done for the symptoms he has. As he presented with chest pain, so we suspected it was a heart attack, and we did the angiogram. Then in the
Oh my God. I
angiogram,
mean, no, I mean, doctor did say it could be something blood. I mean, the heart is not getting enough blood. That's why they just
okay.
want to map out, okay, how much the heart is getting the blood supply. That's it. I mean, they did not talk about any heart attack or something like that. That what you are talking about.
All right. Then let me explain you fully in the easy words. Okay, when he presented with the chest pains,
Hmm.
and we did some X-rays, and we gave him medications for that, but he did not improve. And then we did some other tests. When he presented in the clinic, we did some ECGs and some jelly scan of the heart, which showed
Hmm.
like the heart is not getting enough blood supply, as you told me, which is actually a heart attack.
Oh my
So,
God. I mean, doctor, hold on. I mean, I'm I'm not getting you properly. You mean heart attack, but he was just complaining chest pain, and it's been for last 2 months.
uh, you're very right, Mrs. Parker, but uh, the symptoms of the heart attack are usually the chest pains. Sometimes we could not appreciate this pain is not that severe that we could
I mean, is it
call it.
confirmed on the, I mean, coronary angiogram? What do you mean by that?
Yes, Mrs. Parker, on the from the ECG results and echo jelly scan of the heart, we did to confirm this. We did angiogram to see how many vessels are not getting the supply, could are not able to get the supply to the heart. And in the
So,
angiogram, we found
hmm,
that two of the major vessels that supply the blood to the heart, I can draw it for you, that there are three major vessels, three main vessels that supply the heart the blood,
oh
and
my
two
God. I
of
mean,
them are not able to supplying the heart
so
fully.
you mean out of three, the two blood channels completely blocked?
Not completely blocked, but they are very narrowed down, that the supply to the heart is not enough for him, for the heart to work properly, to function properly.
So what could be the next step, doctor? How can
Yes.
my husband came out of this situation? What's your next plan?
Yes, Mrs. Perker, I can see this must be very difficult for you, but I can give you all the options. There are many options after the angiogram results, because in after the angiogram we have three options. We can, if the problem is very mild, then we can give the medications. If it is severe, then we think of the stenting or the
Hmm.
surgery. But as I told you, that is two of
What
the
you
major
standing, doctor? I
vessels.
mean, I'm not getting properly. You're saying something medical terminology. I'm not getting properly. What do you mean by that?
Okay. Um, I will make it easier for you. There are three options. If
Hmm.
the disease is very mild, as I told you, there are three main vessels. If the narrowing is not very severe, if the narrowing is very mild and the blood supply to the heart is enough for heart to
Hmm.
work, then we only give the medicines to the patient so that he could function well. But if the
Okay.
narrowing is not very mild, it is
Mm.
likely 50% narrow. You can say if it is 50% narrow, then we can put the stent in the vessel so that the blood could be easily get to the heart. But if
So
the narrowing is
I hope in my husband's case, probably the narrowing is not so old. It can be recovered with the medication. Am I right?
Um, I am very sorry, Mrs. Parker, but unfortunately, the narrowing is very severe in case of your husband. It is more than 50%, or I cannot guarantee you the exact percentage, but the narrowing is very severe that the stent cannot be put in the vessel, and we have to do the operation for the heart.
Oh my God, what you're talking about. So is it really necessary? I mean, is there any way that medication can reverse the problem?
Unfortunately, medication cannot reverse as the narrowing is very severe that it cannot, because the medication is to dilate the vessel. Dilate means expand the vessel so that the blood could be reach to the heart very easily. But the narrowing is very severe that the medicines cannot work, even the stent cannot work, and we have to do the surgery because we always have to weigh the benefits and the risks. In case of the
What
surgery,
surgery you
it
are
is
planning
very
for my
high.
husband, doctor? I
It is
mean,
called the
yeah.
surgery is called CABG, like it's coronary artery bypass graft. It is the surgery in which the vessels, which are very narrowed, we can
Hmm.
cut that vessel and put the normal healthy vessel from his legs or some from a vein in the leg, from a vessel in the leg. We get the healthy vessel from there and put it in the heart so that there is no problem in supply of the heart. I know this must be
But
very,
what
very
will happen
difficult work for you.
of the narrowed artery? As you say, there is some narrowing of the blood channel. So what will happen, and how will do that, doctor? I'm not getting properly in a sense. You said
Um,
just a operation, but how it will work in my husband's case?
I know this is a lot of information for
Two
you,
minutes
but the
left.
surgery is done. Yes, we have a proper team, surgical team. We will send you and your husband to the surgical team. They will evaluate him, and then they will talk to the anesthesia doctors. The
Mm-hmm.
I don't know the term for anesthesia. They will speak with anesthesia team who will make him because we need sedation. He will be sedated throughout the surgery operation. They
Mm-hmm.
will make it is a team effort. They will talk to them. They will speak to them, and they will make a decision when and how the surgery will be done. It is all the decision is upon the patient. You need to discuss
But
with your
it seems
husband.
to be very dangerous surgery, doctor. I mean, how much it risky for my husband, doctor? As you
I
said,
know.
it's really going to be beneficial, but at the same time, I'm pretty sure there is certain risks is there, right?
Yes, every surgery has its every operation or every procedure we do, there are risks and there are benefits. But the benefits are way higher than the risks because there are always risks with every procedure. But we have to weigh the procedure risks and benefits. Risks could be due to surgery, like we can discuss it later in our meeting. What are the risks? But all after everything the decision is yours and your decision is your husband, but the need of the surgery is very
How long the
important for him
surgery
because
would be, doctor?
surgery would take around it will take hours, but we will give you a time to meet the surgeon and he can speak to you about all the about every
Time up.
surgery time
The
and
procedure. Okay, 10 minutes
yes,
time up. Fine. How does it goes?
sir. I took very long time to discuss about the cabbage.
What you could
There is
have
so
done
much
differently?
information.
If you think now from the discussion point of view, why you actually invested a lot of time, why you can
Yes.
cut the time, and also proper allocation could be done in which area?
Like I should have told her about the cabbage very first at the very start of the discussion,
Yeah,
but
that's
I
the
had
task.
to, yes, but I had to map out because she had no idea about the ischemia event, so I have to
Mhm,
tell her about the heart attack first and
mhm.
then the
No, it's not heart
angiogram
attack.
and everything.
I mean, I'm going
Okay.
to that part. I mean, the scenario is clean car. You mentioned something which is not written in the scenario. Okay, that also came to me as a surprising. I mean, there is some terminology you said, and which is not written in the scenario. I mean, heart attack is completely different. And the ischemia, I mean, inadequate blood supply is different. Is the pre-stage of the heart attack, right? I say twice, doctor, what do you mean by that? Is it heart attack? No, it's not heart attack. Anyway, we'll discuss thoroughly from top to bottom. Before going to that part,
Okay.
I would like to interact with other candidate. Any important point did Dr. Sija missed, or anyone want to add an important point in this uh, calibration? Then we will move to the discussion part and also analyze the Dr. Sija's performance. Anyone want to add any important point that Dr. Sija could add or could address? Okay, fine. There is no comment so far. So starting from the very beginning, Dr. Sija, you started with your role, right? You're a senior house officer in the cardiology clinic. So the first jargon is cardiology. Cardiology is a jargon.
Yes.
Heart clinic, heart clinic. So throughout the conversation, we noticed there are few jargon. Probably you are taking preparation and minimizing your jargon list. There are lots of jargon we found throughout the 10 minutes conversation. So first one is the cardiology. Second one, you said ECG three times. Actually, electrical activity or tracing of the heart, which is very simple term. The electrical tracing of the heart.
Tracing.
ECG is a jargon. Although many patients know about the ECG, what is ECG? But for the sake of patients, we have to make it complete, refined, non-jargon form, which is electrical tracing activity. You said rightly, jelly scan, which is echocardiography. That's fine. Okay, I'm coming one by one. Then you said angiogram. You did not also mention of what is angiogram. It's a procedure which is designed to map out the circulation of the heart. There are three blood channels you can draw. Okay, so by doing this investigation, we're trying to map out in which area heart is getting inadequate blood according, I mean, to their demand. Okay, so angiogram. And in the middle part of the calibration and conversation, you mentioned about few percentage, which is not written in the scenario, not needed at all. Okay, so 50%, more than 50%. I was a little bit, I mean, I mean, it's clearly written that the task is actually explanations of the coronary bypass grafting, which is clearly team decision, and you just have to explain one by one, step by step. But you categorize the findings. Okay, if the symptoms is mild, in that case you will prescribe the medication, but the scenario is not talking about the mild, moderate, or severe. It's clearly written there is a double vessel disease, and you have to straightly go towards the explanation of the coronary angio, I mean coronary bypass grafting. There is no questions or no scope of mild, moderate, severe. If you said if mild, if less than 50, if more than 50, which is completely, I mean, completely unnecessary. And examiner will note down that you did not read the scenario well. You did not know what is your task. It's clearly written. And even if you look at the top part of the scenario, which is actually the same format, you will get the scenario in the real exam. It's also a big clue. Okay, what's your task in one line? So patient has had chest pain, underwent coronary angiogram, now need coronary artery bypass grafting, which is very pretty simple. Okay, in one line you can get the glimpse of the whole scenario and your task. And just you have to explain with the sympathy and the surgical part, pre-procedure, procedure, and post-procedure. There are lots of things we have to address in this scenario, which is completely missing. I know you explain everything. I mean, patient symptoms, ECG, angiogram finding up to 7 minutes. And then you just, touch the coronary artery bypass grafting, which is, I think, is not adequate. It should be elaborative. It should be explained in a right way. I mean, why and when we do this kind of surgery, why it is needed, how long it may take, and what is the post-procedure surgery and follow-up. I mean, post-procedure follow-up and advice and safety netting, which is very required in this type of scenario. And by the way, when you involve the surgeon from the very beginning, that the surgeon will explain everything, it does not sound good, because it's our task to explain the whole procedure. Okay, then yes, for the follow-up purpose, we can arrange an appointment with the surgical team. That's we can do, but we cannot de-shoulder everything to the surgery on surgeon. It's our task as a patient candidate, as a doctor, to explain the pros and cons of the surgery, what are the things they should follow before the surgery, during the surgery, and after the surgery, which is the main task of this scenario. Dr. Sija, are you with me? So my recommendation would be, when 5 minutes is given to you, don't just underestimate the 5 minutes is required or not. And this is how PCS examiner designed the scenario. So don't take it lightly. Read the scenario very carefully, at least thrice. The first one should be thorough. Second one should be focused. And third one, when you are just reading the third one, again, recalling and revising your that the first one, what you read, what you grasp is up to mark. Okay, and course of the disease. For example, let me draw a slide. So I always say, when you will be given this type of paper in the business exam, a white sheet of paper divided into 4 parts. In the right top, here will be the patient information and your role. Don't underestimate it. And sometimes many candidates memorize it. Don't memorize it. Okay. Don't take overload on your brain. Just do something on the written form. Jot it down in the right top, so you don't have to carry the burden in your memory. Your role, your patient, age, or relative name. Then in the second top, you have to just make a short summary of the course of the disease. For example, patient had chest pain. Then ECG was done. It shows ischemia. Okay. Then coronary angiogram was done. It shows DVT, double vessel disease. Now you have to explain coronary artery bypass grafting. So when you just have a good looks on your paper, the whole scenario will pop up in your mind. So you don't have to, recall everything. The arrow will guide you, okay, what step I have to follow. The patient had chest pain, come to us, we do ECG, it shows ischemia, so it raises our suspicion, and based on that, we do coronary angiogram, which actually confirm there is double vessel disease and critically narrowed. And there is no scope of medication here. We have to go for surgery. And this is the whole part of the scenario. Now, this is the VT, visible task. I always use the VT, visible task. I have to explain CABG, right? When patient will make agreement, I never want to miss any consent. And in this part, non-visible task, which is not written in the scenario, but I have to address. In any scenario, you have to address their social history. Social means, in this case, what they do, with whom they are living with, any type of support is needed or not. And in this case, Dr. Sija, are you with me? What other things It's not visible, but
Okay.
needs to be addressed. Smoking. Do you want to? Smoking,
Mm.
alcohol, and lifestyle. You have to address the lifestyle. Whatever their lifestyle were, since they will go for surgery and they have to change and maintain throughout the life. And there are some safety netting. Safety netting means what are the post-procedure, post-surgical follow-up for surgical advice they should follow and incorporate in their daily life. They have to stay at least 6 or 7 days in the hospital. They have to visit the doctor's appointment after 6 to 8 weeks. It's you not need to memorize every timeline, but if you can, that's really fine. If you don't, just use the common term. Okay, we'd like to bring you back to the hospital after a few weeks to see everything is going smoothly. Are you facing any problem or any post-surgical problem, or is there or not? Okay, after the surgery, you have to complete bed rest for 6 or 7 days. Then you will be discharged in the home, and we advise to take rest for 6 weeks. 6 weeks. You can do normal activity, but if you want to resume back to your normal life, complete office job or anything, at least 3 months or 12 weeks of rest is recommended. Then patient will say, doctor, am I able to drive? Okay, when I back to normal life and when I walk, there are few other concerns naturally come, but you did not, go that level. Didn't touch the post-procedure questions or any concern. Even I was waiting to get some scope, doctor. What should I follow? Okay, what are the post-procedure complication? I did not get the chance. So as a active candidate, you have to ask intermittently, are you following me? Are you getting me? By asking this question, you are creating the natural pause and scope for the candidate, sorry, for the surrogate, that if they have any questions, you are ready to answer. And that's why in the marking sheet, if you look at the marking sheet, I'm highlighting the managing concern actually is an easy task if you just spend a right time, okay, intermittently asking, are you following me? That's why the word is seek, detect, and acknowledge. So when you are seeking, are you following me? Do you have any questions so far at this stage of our conversation? They will say yes or no. Okay, fine. If they know, you can move forward. And that's why I always say after every 4 or 5 sentences, make a pause, create some space. Do you have any questions so far? Are you following me? And by this way, you will get the idea, okay, the surrogate actually getting my point. Now we can move forward, okay? And it's also, two-way win in this type of approach. You are checking, you are also demonstrating that you are seeking for concern. At the same time, you are also understanding, yes, my patient is getting my point. Now we can move to the next point, the next point. Okay. So examiner will understand and also, know that you are you are actively seeking for consent. If they don't have, it's not your issue, but you did your job. Okay. So that part was completely missing. Even sometimes there is some overlap. So when surrogate is trying to say something, stop immediately and just create the proposed scope. Okay, I can see you have some questions or confusion. Can you ask me? I'm happy to answer. Okay, so you can also create that kind of space at the very beginning. We have been gathered here to discuss about your husband's health condition and the test results. I'm going to tell you everything. If you have any questions during our conversation, feel free to ask and I will be happy to answer your question. So you are giving the enough flexibility at the very beginning and intermittently also checking, are you following me? Are you getting me? And now coming to the dialogue. Dr. Sija, are you with me?
Yes. Yes.
Now, when patient has chest pain and there are lots of investigation was done in the hospital before the final part of the surgery. So you have to start from the baseline. Regardless, patients know their husband or their symptoms or a course of the disease, it is better to start with the baseline. What I mean by that, from the case that I came to know that your husband was going through some chest pain. Am I right? Yes. And based on that, we did some electrical tracing and jelly scan of the heart, which shows something suspicious. And that's why we did another investigation we call coronary angiogram, okay, by which we try to map out the blood channels of the heart. Okay, if there any critical narrowing is there, we can detect it. Okay, are you following me? Yes. The test results in my hand and it shows something we are not hoping. Then you can explain, okay, what actually it shows. Okay, so let me explain, and for the better understanding, let me draw. So draw always recommended. I always say always draw. Whenever you get the scope, always draw. There are lots of benefit of drawing. When you are drawing, it's very easy to demonstrate someone what is the pathology and what are the things you are going to explain. Second, you are also getting some time. When you are drawing, our brain works better and you can explain a lot of things with a very short time. Okay, so this is the major artery or blood channels. Okay, what happened in your husband case, there is some critical narrowing happen, which is confirmed by coronary angiogram. Okay, and that's why this part of the heart is not getting enough blood to pump and to send the blood to the whole body. And then when you're trying to do something or walking or climbing a stair, that's why your husband facing or experiencing some chest pain. So we need to fix it. Okay. And after certain degree of narrowing, heart can cope, heart can pump, but in your husband case, the narrowing is critical. So there is no scope to treat the condition with the medication. What we need to do, we have to create the bypass. That's why coronary artery bypass grafting. Okay, so you have to explain everything, coronary artery bypass grafting. So what we're planning to do, the surgeon will take the healthy blood channels from your husband's hand, chest, or leg to create a channel which will bypass the area. This is the narrowed area, right? So it will create the channels from the above to below of the critical, narrowed area. And that's why we'll optimize the circulation. We'll revascularize it or optimize the circulation so that heart get enough blood and can pump effectively. Are you following me? And if you explain, believe me, with a very rough drawing, still surrogate will understand within very few words. And this is the advantage of drawing. Draw makes everything easy. Okay, and this graft, the blood channel, healthy channel, blood channel will be taken. In our medical language, is called is graft. And as we are creating the bypass and bypassing the narrow area, that's why the name is bypass grafting. Are you following me? Yes. This is surgery usually done by cardiac surgeon or heart surgeon who are very expert, and we're planning for your husband. Are you following me? Yes, doctor. Do you have any questions? If they say yes, always use a default word and signpost. Are you following me? Does it make sense? Do you have any questions so far at this stage of our conversation? Then they will say, doctor, it sounds really serious, doctor. You can say, okay, it's a very major operation, but it's not serious. With the expert hand, it will be done. So there is less complication or less chance of any complication because those are going to do already did it 100 times. The same word we usually, phrase in every communication, right? And we can help you and connect you with the cardiac surgeon. The expert team is there. And before the surgery, there are a few other things need to know. And if we go for the surgery, we need your husband consent to move forward. And the surgery will take 5 to 6 hours, sometimes 3 to 6 hours. It's a range. Always, use range. Don't mention a strict point. You can say 3 to 6 hours or hours is fine. And your husband have to stay in the hospital for 6 or 7 days, and then your husband can go home. And I usually recommend, to take complete rest for 6 weeks. Then they can back to their normal life. Then naturally they will ask doctor, my husband is a businessman or he's doing a job, when he can back to their track. So there are a few timeline is there. If you can mention, that's fine. But in the basis mark sheet, if you look at the mark sheet, there are a few important points needs to address. If you can mention the time scale, it's highly expected. And if you can, definitely it will create a very positive impression. So that's why I would say there is some major time frame you can remember. Okay. Don't you have to mention every time frame, but certain time frame. For example, after CABG, they have to take rest for complete rest for 6 or 7 days. Then they can back to the normal. But to gain the full strength or full recovery, they need to wait for at least 12 weeks or 3 months. Okay, Doctor, when my husband can drive, can anyone say? CABG patient, when they can drive?
After 7 days.
7 days.
One
So
week.
there are certain activity they may ask, and believe me, in the real exam, in different center, different concern was there. Let me few activity and time frame we can just remember in our own way. So actually, the duration, for the sake of this procedure, I mean, CABG explanation is fine, everyone can do it, but there are few duration may come in the concern form. We had to address it. Okay, usually the operation duration is 3 to 6 hours. It varies depending on the expertise and how much critical it is. Okay, how long they have to stay in the hospital? Stay time in the hospital. Anyone can say?
Mhm. 1 week around almost.
Yes, 1 week. So it's 1 week. 7 days. Okay, so hospital. How many alphabet is there? I remember in my way. So 3, 4, 5, 6, 7, 8. So roughly 7 days. When they walk, can anyone say? Or sit in a chair? 2 to 3 days. I mean, from third day or second day, they
Second.
can walk or talk. So in the spell of 2, the W is there, right? When I can drive or my husband can drive. Anyone? 5 days. 5 to 7 days, okay? FIVE. So V is there, right? Driving. When will be discharged? Okay, already said 7 days. And then they will, the very, very frequent and very common question, when I can back or my husband can back to their job or business. When they can back. When they
1
can
month.
back. Actually, 4 to 6 weeks.
1 month.
Okay.
Okay.
And during that period, actually, they will be in NSS, they will enroll a program we call cardiac rehabilitation program. And by the way, this term is very important. If you mention in this scenario, examiner will understand that, okay, you have an idea of the cardiac rehabilitation program. Usually those underwent angioplasty or bypass grafting to regain their strength and back to the normal rhythm. They have to undergo some strict regime, diet plan, and training process we call cardiac rehabilitation. Okay, so cardiac rehabilitation process in the meantime, during that period, they should, okay, and complete strength recovery. Complete strength and recovery actually double of these two, 2x. So 8 to 12 weeks. This is the full recovery. Okay, and they can get intimate after few days or few weeks actually. In the, another concern probably in the daily, when I can get intimate with my wife or husband. So this question was there. So 2 weeks, 2 weeks actually roughly there. Yeah. So these are the few common concern. Usually, usually they may ask in the coronary artery bypass grafting like scenario. So what happened actually, Dr. Sijap, in your case, I noted down there are a few jargon, probably will correct, okay. I can definitely can reduce it by minimize by excessive practice. Okay, so jargon was 4 or 5 in number, which is very vigorous and very severe in your case. Okay, so usually according to the mark sheet, if someone utter too jargon, examiner has the flexibility to put you in unsatisfactory part. So jargon is very serious, particularly in the UK center. Okay, so they uh, take it very seriously. Okay, so always try to non-jargon form. If you, just mention slip of tongue, you immediately correct yourself and say, okay, sorry. The what I mean by that is a medical term. Let me explain. Immediately correct it. Okay, as long as you are giving a full explanation of the non of the jargon form, they will not consider it a jargon. If you bypass, then they will take it as jargon. So jargon is very severe and grievous in the UK center. Okay, fail to involve how it is involving, how it is impacting and involving. Actually, impact and involve, these are the two words. I just impact, how it is impacting your husband daily life. Probably her husband is very busy person, impacting their business. Without his presence, the business is falling down. Okay, so you have to ask impact very explicitly, how it is impacting. What do you do for your living, or what do your husband is living? Okay, so any how it is impacting his business or daily activities or job. And fail to involve. Involve means in every decision making process, always, okay, how does it make sense? Do you have any questions and query? This is how you can involve the patient or patient's family in the decision making process. Otherwise, there is no other way. How does it, do you have any questions so far? How does it sound to you? Okay. If there is any optional treatment, for example, patient need first medication is the another medication. In that case, you can seek for their approval. Okay. How does it sound? Which option you want to prefer? For example, in this case, there is no options. And you said if it is mild, if it is moderate, there is no scope is there. Already the decision has been made. Patient needs to be undergone the coronary artery bypass grafting, which is completely and clearly written. So there is no scope for any giving the option. So you just have to involve. Okay, are you following me? It's I know it's really sounds serious, but the surgery is very important for your husband. At the same time, it will be done by expert hands, so there is no fear, and we will make sure that everything is going fine without any complication. This is how you can involve. And by the communication is not just talking or giving the information, syncing with their, pace, taking their body language or any confusion into the consideration, seeking and detecting their nonverbal cues is very important. Sometimes they will create some hesitation. They will not say, I don't know. You have to pick by their, confusing word, or probably they're not um, asking, but just making or attempting to say something. Immediately pause. Okay, are you trying to say something? Does it make sense? Do you have any question? And this small, I mean, asking makes significant difference, particularly in the examiner eyes, and that actually makes the whole entire difference in your communication. Sometimes we just meet just okay, communication is just about giving information. No, it should be, I mean, dual way communication, not giving the information in a one way. You are talking much, okay, just not giving the enough space. So always create the space. If they're very talkative, you can buy time. I know you have a lot of questions. Okay, can you just offer me 2 minutes? You have a lots of questions, and it's very normal to have. Okay, let me explain. Okay, probably your many questions will be answered within few moments. Okay, so this is how you can buy the time. So, Dr. Sija, do you have any questions from your side so far?
No, no, doctor. No, sir.
Okay. So I would say always stress on the jargon part. Be very careful when you are giving the information, and impact, which is actually a very underestimated part. That's why I just highlighted here. Impact is very important, and always involve the family family member or patient in the decision making process. And many mentors say don't mention time scale, but I completely oppose that idea. When you're very confident, mention the time scale. It is written in the scenario, mark sheet. When you can mention the time scale, particularly those are very, fixed time scale, you you are getting the, very good opportunity to create a positive impression in the examiner eyes. So I always say, uh, always mention time scale while you are very confident. If not, then you can, I will back and let you know. Okay. And in this case, judgment will affect it because you did not offer me the right treatment. You mentioned, but if you said yes or some area of, I would say, in the middle of the medications or coronary artery bypass grafting, you are not confident in terms of the clinical decision. You later change and you say that, yeah, your plan is coronary artery bypass grafting, but it should be from the very beginning. Managing concern, I would say in this area, we can improve. Seeking and detecting is very important. Do you have any questions so far? Does it make sense? Okay, any questions? Are you following me? Are you getting me? These are the, very important part. Okay, it's not just all about answering the question. How you're detecting is very important. Okay, if you don't listen properly or skip their concern, they will mark it under the poor listening or lack of empathy. Dr. Moriam, yes? Any questions? Dr. Moriam, you raised your hand. Okay. And maintaining the
Doctor,
patient.
I'm sorry
Yes,
for.
doctor. Mhm.
Doctor, I have question, but not related to cardiology. Is that okay?
Okay, no problem. Yes, you can.
When I done my exam last time, I got one communication session, and
Mm-hmm.
this asked to communicate with patient. He has secondary mets in his lung from unknown primary cancer.
Mm-hmm.
Okay.
Okay.
And discuss with the patient what is the next step, what is the investigation you need to do. Okay,
So can
doctor?
you give me the whole scenario? It was metastatic or secondary deposit in the lung, but the primary is still did not investigate
Unknown.
it. Unknown.
Uh,
Okay.
unknown.
Did they do any investigation like any CAP, CT, chest, abdomen, pelvis?
But the patient asked, she wanted to know what will happen. It's curable or no. So
No.
I told her it's not curable because you are the patient already has the secondary meds, and
Mm,
it makes the treatment difficult, and it's
mm,
advanced stage. But
mhm.
unfortunately, I shocked when I got only six in the session.
Only six. Okay. What their feedback?
Unsatisfactory, but I don't know. They didn't write comments. To be honest, the handwriting is very bad, so I can't understand.
Hmm. So the actually, what I got from your explanation, okay, probably they cut the marks from each area, but it can be due to you're not giving the enough information. As a doctor, we have to show the proper judgment. If there is no CT cap yet done, we have to show, okay, to find out the origin of the cancer, we have to do special imaging of your chest, tummy, and lower tummy. Okay, from
Mhm.
from where the cancer is coming, but we are pretty sure that the cancer in your lung, which is actually spread to your lung. Okay, but we have to
Ah,
find out the primary source to treat it carefully and to treat it perfectly. So that's our main task. And I'm sorry to say it's not curable, but we can minimize the symptoms. We can ensure a very qualityful life, rest of your life.
ah. But it's okay, as I say, I told her, no chance to be cured. I'm right.
No, it's fine. It's fine. But you have to bring some sympathy. When you are planning to talk something, as a patient's point of view, they are not ready to accept. already, it's not easy for me, right? As a patient, okay, it's not curable. You have to soften your voice, lower your voice, lower your tone, and raise your shoulder to show some sympathy and act as if you are actually putting yourself in their shoes. So you can say, I'm so sorry to tell you, it's not curable. However, there are very good treatment options that can ensure and improve your quality of life. We can minimize the symptoms and your suffering. But our primary task, okay, as we, did not know what is the source. Okay, we have to find out the underlying source and origin of the cancer to treat it. But it's not completely curable. Again, it's not curable. Probably the scenario actually go towards the palliative or something like that. I don't know the exact tone of the scenario because it's very important to read the scenario and tone of the scenario. Okay, if in the task bar, if it is written that consultant has decided that there is no curable, only you have to continue the palliative treatment. The tone would be a determinant factor, how you will address this part. Okay, there is few cancer which has potential chance of survival after at least 4 or 5 years. Some cancer is really, really dangerous and patient can die within few months. So it depends upon the tone of the scenario. Dr. Moriam, did you get my answer?
Appreciate, doctor. Thank you so much.
Okay, you are most welcome. So if anyone has any questions regarding this scenario. So these are the, you can keep a screenshot. This is the in details of the coronary artery bypass grafting, okay? By mentioning this information, you can give a lot of information to the patient. Patient may ask about the angina, although it's not completely relevant or it's not written in our scenario part, what is angina, but the scenario may come into different form. So you can have a screenshot, you can explain everything. Even explanation of the coronary angiogram can be, right? So in that case, you have to say, okay, we'll insert a plastic flexible hollow tube through your blood channels of the hand or groin and to reach the heart, okay, to find out and map out the arterial circulation or blood circulation of your heart. If there any critical narrowing, in that case, if the narrowing is a single vessel affecting the single blood channel, in that case, we will put a metallic channel we call stent to restore the blood circulation. But in this case, particularly, we're dealing with the coronary artery bypass grafting, so you have to explain everything. Okay, and these are the common, important point you may need to recall, because when they sit, when they walk, when they stare, we just discuss everything. You can have a screenshot of that. And always in any cardiac scenario where patient is planning to be underwent primary coronary intervention or angioplasty or cardiac surgery, always utter a word, cardiac rehabilitation is their very favorite word. To the examiner, they want to hear it. In the lung case, pulmonary rehabilitation, neuro rehabilitation in the neurologic case. These are the very key word examiner always fond of. So always try to bring into your explanation. So if there is any question, we can take any questions from your side. Any questions from anyone?
But it's for another scenario, like the scenario we get, like a 28-year-old, 18-year-old son, he got fits, and then it was found that he was taking ecstasy, but
Mm-hmm.
but we cannot tell the father about ecstasy. But what
Okay.
if the father asks us that whether it is because of any drugs or something? How should we answer that concern?
Okay. If further actively ask, okay, is there any drug or any abuse or IV drug or something my daughter or son did take? In that case, as a duty of doctor, you have to keep it hide. Okay, how you can say there are lots of factors can went wrong. Okay, which is really tough to say right now, but we're thinking in lots of possibilities. It can happen due to poor sleep, skip meal. Yes, drug can be another factor. and extreme light or other factor. Okay, but it's really tough to say which factor actually causing the problem. I think that can be a very better answer. If age is more than 18, where patient is completely mentally capacitated and competent, as a doctor, without his or her permission, you cannot, I mean, and cannot give this information to their parents. Okay, only you can invite. Okay, we can have a short meeting or discussion where your daughter will be there. Then we can discuss everything. Okay, but right now we are thinking a range of possibilities. We are fixed, try to treat the condition. Okay, there are lots of trigger could be. Yes, drug could be another factor, but to find out the underlying trigger, what actually happened, son or daughter case, would like to arrange a short meeting where your daughter will be present there, and that would be better. Did
Okay,
you get my
thank you.
point? I mean,
Yes,
just
yes.
create the space and give the explanation to the examiner that you know the rules. That's it.
Mhm.
When you will say, there are lots of factors could be, drug is one of the possibilities, but to find out that, we can have a short discussion where your daughter will be there and you will be there. Then that would be the better environment. Okay, but we are now focusing. It's called defocusing. You are defocusing the attention. Right now we are focusing your daughter and our
Help.
son's well-being. Okay, then we
Mhm.
can find out and figure out what's actually going wrong, and we can take your daughter and son's uh, decision or explanation into the consideration. But you
Okay.
cannot. The straightforward answer, you cannot. You cannot break or tell something which should be confidential. Without their permission, you cannot.
Okay.
Fine. Thank you for joining. If you have any questions, you can ask right now or in the WhatsApp group. So if there is no question, we can conclude the section for today. Thank you. Good night. See you soon on the next session on different topic. Till then, goodbye.